The presence of a breast lump is commonly linked to breast cancer, but the symptoms can differ based on the particular type of breast cancer you have. Even though a lump is a common indicator, it's feasible to experience breast cancer without one. So, if you want to know everything about breast cancer signs and symptoms, this video is for you. Breast cancer warning signs and symptoms you shouldn't ignore. Early signs. The main sign of breast cancer is the appearance of a new lump or mass in the breast tissue, often characterized by features like hardness, irregular shape, and typically painless. However, some breast cancer lumps can be tender, round, and soft. Other breast cancer symptoms include changes like swelling, thickening, size or shape alterations, skin irritation, dimpling, skin discoloration, and breast or nipple pain. Nipple inversion, nipple discharge, and swollen lymph nodes can also be indicators. While these changes may have non-cancerous causes, it's important to promptly consult a doctor when noticing any changes in breast tissue to rule out the possibility of cancer. Symptoms for specific types of cancer. Numerous variations of breast cancer exist, each originating in distinct breast regions and potentially impacting diverse tissue categories. As a multitude of breast cancers remain asymptomatic, consistent screenings are advisable to detect the disease during its initial phases. In the subsequent section, we delineate the classifications of breast cancer and their associated symptoms. Lobular carcinoma in situ. Lobular carcinoma in situ refers to an abnormal cluster of cells within the breast's milk-producing glands. While it doesn't typically spread extensively to nearby tissues, it isn't considered cancer. However, it does increase the risk of other invasive breast cancers. Usually, it's detected during a breast biopsy for unrelated concerns or sometimes seen as tiny white calcium deposits on routine mammograms. Before we go any further, if you find this information valuable and want to stay informed about crucial health topics like breast cancer, make sure to hit that subscribe button and give this video a thumbs up. Your support helps us spread awareness and save lives. Thank you. Invasive lobular carcinoma. This originates within the breast lobules, the glands responsible for milk production, and infiltrates adjacent breast tissue. There are instances where it can extend to other body regions. During its initial phases, invasive lobular carcinoma might not exhibit symptoms, or an individual could encounter thickening or firmness of breast tissue, as opposed to a clearly defined lump, an area of fullness or enlargement in the breast, a modification in the texture of the skin covering the breast, inversion of the nipple. Ductal carcinoma in situ. Ductal carcinoma in situ designates an anomaly within a single milk duct. Upon diagnosis, these cells have not infiltrated the adjoining breast tissue. Nonetheless, possessing ductal carcinoma in situ heightens the potential of future invasive breast cancer. Infrequently, an individual might observe a breast lump or experience nipple discharge. Invasive ductal carcinoma. Constituting approximately 80% of cases, this represents the most prevalent form of breast cancer. Invasive ductal carcinoma initiates within the cells lining the milk ducts of the breast and infiltrates the adjacent breast tissue. For some individuals, the initial indication is the emergence of a novel lump or mass within the breast. Individuals affected by this type of cancer might also encounter swelling affecting part or the entirety of the breast, pain experienced in the breast or nipple, irritation or the formation of dimples in the skin covering the breast, redness, scaling, or thickening of the skin or nipple, nipple discharge, inversion of the nipple. A lump was detected in the underarm region. Less common breast cancers. Several less common breast cancer variations encompass triple-negative breast cancer, characterized by cancer cells lacking estrogen or progesterone receptors and producing minimal HER2 protein. Consequently, hormone therapy proves ineffective against this cancer. Inflammatory breast cancer. This infrequent breast cancer type forms when cancer cells obstruct lymph vessels within the skin, leading to breast enlargement. Phylloides tumors. These tumors originate within the breast's connective tissues. While the majority are non-cancerous, some do turn malignant. Paget's disease of the breast. This cancer subtype emerges in the breast ducts before spreading to the nipple and areola. Angiosarcoma of the breast. This cancer can impact breast tissue that arises from cells lining blood or lymph vessels. As we wrap up this discussion on breast cancer warning signs and symptoms, here's a question for you. Were you previously aware of all the potential indicators we talked about today, or did you learn something new? Feel free to share your thoughts in the comments section below. Don't forget to like and subscribe for more essential health insights. Thanks for watching. Until next time, stay well.